Hi there, it's Dr. Rebecca Harwin for ConquerYourPCOSNaturally.com, and today I wanted to talk about fatty liver in PCOS, what's the connection and what you can do about it, because it's a problem I'm asked about reasonably frequently. So PCOS is a complex and under-considered endocrine disorder that is far-reaching and beyond a fertility issue. Even though a significant number of research studies have been conducted on the topic, many areas still remain unclear. PCOS is associated with a number of physiological alterations, including an increase in the production of androgens. Women tend to experience irregularities in their menstrual cycles, and this forms part of the diagnostic criteria. In some patients, small cysts may also develop on a single ovary or both ovaries, but this is not necessary for the diagnosis of PCOS, as strange as that may sound. Recent studies have also suggested a possible link between PCOS and fatty liver disease. Nonalcoholic fatty liver disease, also called a fatty liver or NAFLD, is a common condition that leads to the development of chronic liver disease. The condition is associated with a number of effects in the body and can present multiple unpleasant symptoms in those who are affected. So in this video, we will address the possible presence of fatty liver in women with PCOS experience. We will also consider the most appropriate diagnostic approach and how the conditions can be effectively managed through pharmaceuticals, because I'm asked about them, and lifestyle modifications. So what is the connection between PCOS and fatty liver? Several studies have confirmed that the presence of fatty liver is more prevalent in women with PCOS. One study explains that several mechanisms involved in the development of PCOS have also been linked to an increase in the risk of non-alcoholic fatty liver disease. The study explains that several risk factors for fatty liver become more evident in women with PCOS. These include the increased release of androgens, often thought of as male hormones. Elevated levels of androgens like testosterone have been associated with a higher incidence of insulin resistance, which is one of the primary risk factors, along with obesity, for fatty liver and also for PCOS. So women diagnosed with PCOS ought to consider being screened for fatty liver due to the high increased incidence amongst women for this condition. And screening of the presence of fatty liver becomes especially important when there are higher risk factors like obesity, with a particular focus on those who have abdominal obesity or excess fat around the midriff and in the tummy. People and their health professionals with metabolic syndrome and insulin resistance need to discover more about the connections between these two conditions, as regular screenings may detect liver issues earlier than they're currently being detected. In many cases where fatty liver is present, the disease will remain asymptomatic during the earlier stages of the disease, symptoms only occurring when the liver has become overwhelmed and struggles with its role, or medically put, when decompensation occurs. Yet early detection and action may stop a fatty liver in PCOS from getting a foothold and progressing. The diagnosis of non-alcoholic fatty liver disease is conducted by a 4-step process. You don't necessarily need to go through all of the steps, because if it's likely that you have a fatty liver, you can take steps to help reduce a fatty liver and boost recovery. So accurate diagnosis is important, as certain health conditions may yield similar effects and symptoms of a fatty liver. You really want to know what the accurate diagnosis is. So the first step is a physical examination. When your liver is inflamed, your health professional may feel it is enlarged by pressing under the right side of your rib cage. They might also gently tap, which is called percussing, on the area to see how large your liver appears to be. It's a little like tuning a musical instrument in a way and listening to whether the notes sound right, except in the case of the body, there are different densities that give different sounds rather than different strings. So just like tapping on wood and then tapping on an empty milk carton, you can tell that they sound different. And this gives a clue to what is underlying the tapping, the density in the tissues underlying the tapping. The second step is testing by blood. These don't give a definitive answer, but altered liver enzymes can give a clue as to what's happening in this important organ. The third step is imaging. So an ultrasound is the usual imaging tool able to detect the presence of excess fat in the liver. The fourth step is biopsy. This is often not done, but this is where a needle is inserted into the liver and some tissue is removed for examination by the pathologist. Like I said, this is not always necessary. However, it is the definitive way to know whether you have a fatty liver. The possibility of other health ailments contributing to liver problems need to be ruled out before an official diagnosis of non-alcoholic fatty liver disease is made. Then we come to the important part, appropriate management solutions. So early initiation of treatment and management plan for fatty liver can help to prevent further damage, and the right options can help to reduce the severity of existing symptoms. At the moment, there are no pharmaceutical approaches that have been approved by the FDA for the treatment of fatty liver. But while no official pharmaceutical drugs have been approved, one study explained that certain drugs can be repurposed and used to treat the condition. These medications are not my area of expertise, so while I've listed them on the slides, it's best to speak to your medical doctor about these if you think they might be the appropriate way for you to go. However, as our focus at Conquer PCOS Naturally is on naturally, it's key to look at how lifestyle and natural approaches may help you. So let's look at treatment for non-alcoholic fatty liver disease and what I consider the first line approaches, as well as not just first line, but any point in this disease, these approaches should be implemented. So the liver has an incredible ability to regenerate and repair, and lifestyle changes can address a number of issues contributing to continued damage to the liver. And this is serious stuff for health as a health issue, so please don't fob this diagnosis off and think that there's nothing that you can do. So weight loss where needed is an appropriate course of action. Issues such as insulin resistance need to be addressed through lifestyle modifications, and this will take the pressure off the liver, so to speak. The right food choices are important. The handy thing is, following a PCOS diet plan is key for weight loss, PCOS signs and symptoms, and also for reducing a fatty liver. That's 3 birds with 1 stone. So which foods are helpful? Let's take a look. Low glycemic load foods, antioxidant rich fruits and vegetables, healthy fats like those found in fish oil and flaxseed oil, ideal levels of vitamin A and E, as these vitamins have been shown to be low in people with non-alcoholic fatty liver disease. I'll include a link to the supplement system that I take and recommend below the video. We also need to address poor food choices. So there are a range of foods and food components that have been shown to damage the liver and ought not be consumed in women with PCOS, and especially in women with PCOS that also have a fatty liver. These include, unsurprisingly, high fructose corn syrup, trans fatty acids like those found in chips, bakery products, pie crusts, deep fried consumables, and of course sugar. Now I want to talk about coffee because I'm often asked, is coffee okay? It depends, I guess, what your aim is. So obviously coffee's been linked to weight loss in a way to sell lots of supplements. But one study also suggests that consumption of unfiltered, unsweetened coffee may aid in the treatment of fatty liver. But I want to make a note that you need to be careful of excess caffeine intake because it is a stimulant, and as such, it may not be ideal for women trying to lose weight or learning to distress, which is really important in PCOS. We also need to focus on the digestive system. As I've talked about before, I can't recall ever having consulted with a woman that has PCOS who doesn't have some level of gut involvement. And with the gut linked to inflammation, insulin resistance, nutrient deficiencies, and so much more, it's no wonder it's important to liver health. After all, inflammatory products can be heaved from the gut and into the body, and then they head back to liver for processing and removal again. As the author of the article Focus on Emerging Drugs for the Treatment of Patients with Non-Alcoholic Fatty Liver puts it, fatty liver has a strong association with microbiota, or the bugs of the gut. With this in mind, refined sugars should be removed from the diet, fiber intake should be sufficient, stress management is really important. You need to take easily absorbable liquid nutrients to make sure that they're absorbed. Time needs to be taken to eat meals slowly, and you need to chew thoroughly, and probiotics can be very helpful. If you want more recommendations on how to improve the gut, check out our article, The 16-Point Checklist for a Better PCOS Gut Now, at Conquer Your PCOS Naturally. The majority of studies for non-alcoholic fatty liver disease are focused on the use of vitamin E. Vitamin E is a natural nutrient, or it should be natural, considered one of the most potent antioxidants. The use of vitamin E supplements may help to reduce oxidative damage in the body, including the liver, and it may help with other functions as well. Vitamin E is found in food sources like avocado, spinach, hazelnuts, almonds, and sunflower seeds. And there are supplements that can help with insulin resistance and inflammation as well.